I'd like to ask first, the Minister whether we're paying our radiography students. I understand that the student nurses are being paid now, and I think, out of fairness, that they should have an equal deal. They are dealing directly with COVID patients every day. I also want to ask about the power to prescribe. I know that the Minister has issued an executive order broadening the power to prescribe to pharmacists, and that's welcome. Optometrists have asked if they could have the power to prescribe antibiotic eye drops, and that was to take pressure off GPs at such a difficult time. I want to ask the Minister about contact tracing, which is something I raised last week in the context of Google and Apple producing an app together. We obviously need effective contact tracing in order to move on to easing the restrictions. Mobile technology has been central to South Korea's success of tracing the contacts of every person infected with the disease. And the European Commission is tracking at least 14 apps that have been developed by Member States. The Irish Times reported that a company named Nearform is developing a contact tracing app on behalf of the HSE, but we've not seen any specifications or release plans for this app. I have a background in software and medical statistics, and I'm concerned that we only have one chance to deliver a useful app, and that we should not rush an inadequate solution in front of the public, because if adoption is low, the purpose will be undermined. I've got the following questions. How many people are currently actively working on contact tracing? How many COVID victims have they identified and notified? What is the daily rate of such identifications? What is the planned release date for the Irish contact tracing app? Who is developing that app? Will the Minister publish the technical, data privacy, cryptographic and API specifications for this app, just as Google and Apple have published theirs? Has a data protection impact assessment been carried out? And if it has not, will it be? Will the app comply with the recommendations of the European Commission's e-health network as to how such apps should handle privacy? Recently, the French digital minister, who's called Cédric O, he said that privacy specifications outlined by Google and Apple should be relaxed in order to give more control over data to health authorities, to national health authorities, which is a controversial position. Is that a position that the Minister shares? Studies indicate that for this kind of app to be effective, we need half the population, or more than half the population, to voluntarily adopt it. And it's similar in this way to herd immunity. What's the Minister's target penetration level of usage for this app? Does the Minister agree that it would be better not to rush out this app, and that we should answer these questions before launch? Thank you.